Type 1 diabetes predominantly affects children and young adults, and it occurs for reasons that we don't know why, but it occurs when the body loses its ability to produce a hormone called insulin, and that results in the blood glucose levels becoming elevated and kids becoming progressively unwell. Glucose is the primary fuel of the brain, and if you think about when we talk about developmental goals in childhood and adolescence, development of the brain is the most important goal. We are, I guess, one of the world leaders in this area. Have identified that the leading complication of type 1 diabetes during childhood and adolescence currently is adverse mental health.
Because I got it when I was only 6, I was very dependent on my parents at the start, and I didn't find that at that stage very difficult. When I became more independent, I found that quite hard, having to think about everything myself, and I didn't really come to terms with it for until a few years after I got diagnosed. You just have to constantly check up on yourself, and it's that annoying thing of the constantly thinking about everything that's happening around you and making sure it works out just to be safe, and that it's just an extra thing to think about, and sometimes if you're stressed you really don't want to have that.
We're trying to understand at both an emotional and at a cellular level what's going on with our kids, and what we're able to do to support them both at an emotional level and at a biochemical medical level. Our hope is for our children to have the optimal mental health and cognitive outcomes at the end of their neurodevelopmental period, so by their late teens, early 20s. Our research is right at the cutting edge. We are world leaders in this field, and much of our research hasn't been undertaken by anybody else, and it's difficult to fund. It's an uncomfortable area for traditional diabetes funding groups who are more focused on the cure of diabetes or traditional diabetes-related complications such as eye disease or kidney disease. Adverse brain development in diabetes is a relatively new area. It's a growing area, but this is an area that traditional funders really haven't embraced yet.